I'm Michael Scalzone, Executive Vice President and Chief Quality Officer of the Guthrie Clinic.
Great. Go ahead and spell your name, please.
Michaelscalzone.
Great. So first question, how many New York State hospital beds does Guthrie already have?
So the Guthrie Clinic has 5 hospitals in our system, 2 of which are in New York State. The combined licensed capacity beds is 132.
Great. And do you have any plans for how Guthrie will find the additional space mandated by the governor?
Yes, we do. We've had emergency preparedness for a long time, and we always look for more space that's available. The governor asked us for 2 plans, one for a 50% increase in capacity and the other for a 100% increase in capacity. We're confident we have those space in those plans and that we will be able to use that if needed.
Great. And can we touch on the tents that we've seen going up at different Guthrie facilities? How will that plan help in the larger picture?
Sure. So the tents are extra physical space, and they can be used for a number of different things. And so we are preparing by having them ready should the influx of patients be quick. They can be used for different functions such as triaging patients as they arrive, or even, if needed, extra hospital bed space.
Great. All right, let's see. Do you fear that adding more people would risk the spread of COVID-19? I think what they're trying to get at here is, maybe everything from additional staff to take
Right.
care of the influx of patients and
Right.
then the sheer number of patients that we could see.
Sure. I know there's a lot of concern about having groups of people together, and the public has been asked to increase the distance between one another. At the hospital, we're very used to taking care of patients that have contagious diseases, and so our hospital staff are prepared for that. Even as we get an influx of patients, we feel very comfortable we have both the equipment and the space to be able to protect our staff and patients.
Great. And do you think that the order from the governor is a good idea?
So being prepared is always a good idea. So we feel like we spend time preparing, and this has been a good idea to be able to put it into a very specific plan, which will be able to be coordinated with other facilities in the region. So should we have a significant need, we can all work together.
So any messages that you wish to get out to the community?
So I'd like to say how overwhelmed I've been by the generosity and the hard work that staff in our organization are doing, and I'm sure that's very similar to what's happening in other organizations. In these very scary times, it is wonderful to see the community come together to protect each other.